You're welcome back to The Echo. The West African Commission on Drugs has called on governments in the sub-region to decriminalize minor and non-violent drug offences. According to the Commission, criminalization of drug usage and possession puts pressure on law enforcement agencies and also provokes human rights violations.
At a workshop to develop the capacity of civil society representatives in the region on drug policy, prevention and treatment, a senior policy and operations manager of the International Drug Consortium, Jeremy Bridge, criticized the approach in fighting drug use in the sub-region.
The problem is that this approach simply has not worked. Because even in the countries where people are executed for drugs, even in the most repressive countries in the world, drug use continues. And across the world, like I say, we've had this war on drugs for 50 years now. And we have not been able to stop drug use. We have not been able to stop drug trafficking or drug supply or drug production. We simply cannot stop this phenomenon. So this is why we're now arguing that we need to take a different approach, because not only has this war on drugs not worked, but it also has a really damaging impact on individuals and on communities.
A commissioner, West Africa Commission of Drugs, Adiola Ogurumbi, insisted the use of illicit drugs should be seen as a major public health threat. He again tasked African governments to be proactive in the fight against the drug menace.
Africa has a drug problem, but most times we don't get the government doing something drastic about the issue. All what we see as a policy response is about improving law enforcement, and that is the challenge. We need to begin to see, drug issue as an issue that affects the citizen, the population, especially the young people who are initiating drug use, and we should see it as a development agenda, we should see it as a public health issue, we should see it as a socio-economic development agenda as well.
Right. And my guest tonight will be talking about this particular issue of drugs. And to my immediate left is Christian Lion Loco. He is Public Relations Officer of REMA Ghana. And he is also a rehabilitated ex-drug addict. And then extreme right, Mamadou Diallo. He is with the Outreach and Advocacy West African Commission on Drugs. Gentlemen, welcome. We'll talk more about drugs tonight. But let me begin from Mamadou Diallo. So, first of all, the approach in fighting the drug menace is not working. The idea of improving law enforcement is not helping either. What and how do we fight the menace? Let me begin from Mamadou Diallo.
Well, I think we need to be very careful when we're talking about fighting. Is it a war? We've realized that the war on drugs failed.
Okay.
And what we could realize is that this is a major concern for different reasons, for human rights reasons, for health reasons, for societal reasons. So rather than fighting or leading a war against individuals, we think that our fellow citizens in Ghana and in the regions, in the countries from the region, should be seen with a different perspective to tackle the real challenges they face and we face.
It should not be a matter of fighting it.
No, we can call it a fight, but if we look at it as a fight, we'll be looking at foes and adversaries. This is a joint effort that we have to do. We have to change our perspective, and we have to make sure that our institutions and our priorities are adjusted to a situation that is not beyond control, but that requires a significant awareness and the sustainable.
Let me just stay with you.
Yes.
What has been wrong with the initial approach in dealing with the drug menace?
I think what is still wrong is to look at it without taking the human element of it. What is happening in our communities? What are Adel was mentioning the youth issues. Who is consuming drugs? Why do they consume drugs? What are the consequences to them? So maybe the perspective shouldn't be seen from above, but looking around and looking at what is it that is creating the complex situation we see in jails, the complex situation we see in some of our communities, and the challenges that are existing for law enforcement responsible people as well.
Let me come back to Christian. Christian is a rehabilitated ex-drug addict. Let me find out from you the way we are tackling the drug menace. Is it perhaps what pushed you deeper into the use of drugs?
Well, I think from my perspective, and maybe I can safely say from the perspective of those who have been addicts or are still persons living with drug abuse or drug use, as a myriad of reasons.
Right.
Yes, there's a potpourri of reasons why people actually get hooked on drugs. It has social, psychological, economic, and sometimes even geographical connotations. People get hooked to drugs for various reasons. But the issue here is that it is something that cuts across the social structure. You have drugs.
So in your case,
yes.
What pushed you into it?
Okay. Peculiarly for my case, I got into drugs. I should say I shouldn't have in the first place, right. Because I come from an affluent family. My dad was actually the director of social welfare in Ghana, and my mom, a nurse who introduced family planning into Ghana. I was in school, Presec, Legon, precisely.
That's a prestigious school.
Yes, and quite, you know, academically astute. I was schooling and doing very well out of, should I say, adventurism, peer pressure, but then I also wanted to experiment because it was like everything was at my disposal. And so in a bit of trying to have a little bit of fun, I got myself into drinking, smoking, and then I continued to the University of Cape Coast, where I majored in English with a first class. Actually, as the best student in the university. My lecturer is now the Minister of Education. I was there with Rashid Pelpo, the Honorable Minister. And I mean, a lot of people watching me now know who is talking.
Right.
And so it is just to give you an idea. But then there are others who didn't have the opportunities I have, but also found themselves in drugs. So how do you tackle an issue like this? You have to look at it with a human face.
We don't treat you as a criminal.
Exactly. Exactly. You treat the person maybe as a patient, as someone who has a disease, someone who needs care and attention, and needs medical assistance or whatever help that is available to get the person out of the situation, out of the addiction.
Let me speak to Diallo. I'll come back. So Diallo, he just made a point that then brings to the fore that the target is then to chase the drug lords, but not the users.
Yes, it is to change the laws, but it is to change people's perception. Because you can change laws, but as long as people do not change the way they implement the laws or the way they understand the laws, you will have a hard time making sure that a judge is understanding what leads someone to drug consumption. Or a policeman is understanding why this person is in this very situation whereby he will need support rather than punishment. So
what you're talking about means that then there should be a total change of the laws.
Yes.
Because for instance, if Christian is caught in possession of drugs, I mean, the judge knows the law and he gets the jail term.
Yes.
The judge is not going to say that, well, I need to treat Christian with that kind of thing you're talking about.
Sure, but this is the top. This is the this is the top of the iceberg. This has to be changed, and for a policeman to change, if it's not in the law, it has to be in the law.
How do we change this? Because these are laws that we have. So if you're talking about the need to change it, where should it start from?
Where should it start from? Well, first of all, I think as any legal initiative, I mean, you're looking at what's happening. So you're looking at the evidence. How is the issue? What's the situation of drugs in Ghana? What's the situation of drugs in West Africa? And this is where the West Africa Commission on Drugs report comes in. because we actually do not know what is happening. We have anecdotal evidence. We have a few reports. But we need to know what is the reality of drugs. And from that, what are the legal tools we have? What are the resources we have, the financial resources, the human resources, the community resources? I mean, what is it that we can bring to the fore for this issue to be tackled, taking into account certain principles that are in some of our, most of our constitutions. So it takes a lot of political courage.
And that means a lot of lobbying too, from the West African Commission on Drugs.
Yes. Yes.
To get things done.
Yes.
Can we, let me come back to Christian, because we're getting ready to wrap up this interview. So Christian, you went into it, that you are now heading REMA Ghana. I'm sure you're...
Yes, I'm the public relations
officer. Now, you got a chance to be rehabilitated. Now, with what the West African Commission on Drugs is talking about, how then do we use it? Treat people who are in possession or using drugs not as criminals. How do we use it to get a lot of us who are into drug use rehabilitated like you?
So it calls for a lot of advocacy, education, information, and creating public awareness. That is sensibilization of the entire spectrum of society. That means that we need to get the lawmakers, the people in government, and the entire society to begin to take a critical look at this scourge of drugs. I was lucky to be able to come out of drugs, and now wherever and whenever I get the opportunity, I use my past experiences as a lobbying focal point. I try to make people know that it is possible. Yes, you can go into drugs, but you can come out. Sometimes, and most of the times, it even makes you a better person, because now I can see the issues as they are, having been there, and therefore I see a drug addict and I know that, look, this is someone who has a health problem. The person is suffering from addiction, the same way you might suffer from malaria or diabetes or hepatitis B. And then there are medical solutions. There are other ways of helping people to come out of drugs, just as I have. I was fortunate to have been in REMA. REMA is actually a charitable, Christian charitable organization, an NGO worldwide in over 70 countries, with its main focus, it's an acronym, rehabilitation of the marginalized. And we are into rehabilitation. In Ghana here, we have homes, we have centers, and we normally get any least opportunity we get, we go out and we try to, you know, advocate, try to create awareness of the menace and as well as the solution. Drug as a disease has a remedy. People
which
can
we need to keep fighting for. We'll have to continue this interview some other time. Christian Lion Loco is a public relations officer of REMA Ghana and also a rehabilitated ex-drug addict. And Mamadou Diallo is with the Outreach and Advocacy West Africa Commission on Drugs. Grateful to have you, gentlemen. We'll certainly continue this discussion. Grateful. Let's take a short break. After this, we'll come back.